on Health Watch. Yes, the dry season is here and it comes with a lot of infections. One of it is meningitis. I'm sure that you've heard that name before, but today on the program, our guest will be telling us what we need to know in terms of the causes, who is at risk, signs and symptoms, and of course preventive measures. Plus, we have a feature on World AIDS Day. World AIDS Day was celebrated on the 1st of December, and this feature we're talking about the modes of transmission and of course the preventive measures as well. My name is Nkem Kibe. You know I love to do this with you every week. We'll go on a short commercial break. When we return, you'll meet my guest. Stay with us.
How to make a perfect bowl of love? A perfect blend of taste that brings every ingredient to life. The fusion of different spices. The unique aroma that rejuvenates your senses. The heartwarming deliciousness. And the satisfaction that comes from every bite, which makes you say, I love my Indomie.
If you're just joining us, the program is Health Watch, reaching you on your number one station, NTA Lagos Channel 10, the station for excellence. And our focus today on the program is on meningitis. My guest today is a public health physician and the person of Dr. Ebuka Anyachebelum. You're welcome to.
Thank you very much. Thanks for having me.
I remember the first time I heard about this infection. There's this orientation about your neck bending and all of that. So it's kind of scary. Yeah. And I have really not seen anyone with this infection. So the first question would be, what is meningitis?
All right, thank you so much. So meningitis, I'll just give a small preview. In the brain and the spinal cord, which is the head and at the back, you have a covering, okay? That is usually there just for protection, and then it contains a fluid. Okay, that's also helpful, for a lot of things in the central nervous system. So that covering is called meninges. Okay, and the meninges has about 3 layers. It has the pia, the arachnoid, and dura. Okay, so there are 3 layers or 3 coverings. Now, usually it's well protected, but then if there is a loss or a break, in that protection, you can have an infection of those meninges. And then when you have an infection, okay, of those meninges that covers the brain and the spinal cord, you have what you call a meningitis. So meningitis is just simply an infection of the meninges of the brain and spinal cord. So usually in the infection, you have what you call inflammation. Inflammation generally just means that there is a swelling around those areas, okay, as a result of something that has insulted the meninges, usually from infectious causes. So it's just an infection of the meninges.
Okay, I hear it's very common around this period. We're already in the last month of the year. And the question would be, what are the causes of this infection?
Okay, yeah, thank you very much. For meningitis, we have a lot of causes. And most times, they're usually infectious causes. So the common ones are the bacteria, the fungal, the viral, and the parasitic kind of infection. We also have the non-infectious causes, like cancer can also cause it. Some certain drugs, okay, like ibuprofen, non-steroidal anti-inflammatory drugs can also cause, but then it's not as common as the infectious causes. And then among the infectious causes, the most common is actually the bacterial cause. Okay, so the bacterial cause is one of the most common, or if not the most common cause of meningitis compared to others. And then the presentation of a bacterial meningitis is usually most times severe compared to other causes. So the bacterial, viral, protozoa, and the fungal are the common causes of meningitis, both in adults and in children and infants.
Okay, is it a communicable disease? How does this infection happen?
There are different modes of transmission, depending on the cause of the infection, but one of the most common mode of transmission for most of the meningitis, especially the infectious meningitis, is via or through respiratory droplet. So for example, let's say I harbor this infection in my nasal cavity, that's in my nose or in my throat. I might not even show any symptoms. And then someone comes around me and then I'm coughing, I'm sneezing, or I kiss the person, or there's a form of contact of body fluids. The infection can move from that person that is harboring it to the person that doesn't have it. And then from there, it moves, from that place towards the brain and the spinal cord. And then when it gets to the brain and the spinal cord and invades the defense mechanism, as I said earlier, one can now have meningitis. There are other causes. There are other ways in which it can be transmitted. One of the ways is through child delivery. So if there is a particular infection, okay, we call it the group B streptococci. It's usually in the female genital tract. Okay, usually the vagina, as it were. Now, if a woman has this infection in the vagina prior to childbirth, as the child is passing through the vagina during the delivery, one can actually have meningitis. So you see children within 0 to 28 days of life coming down with symptoms of meningitis. Most likely is due to the passage of the birth canal that has been affected with this bacterial infection that can cause, meningitis in children. Then some other causes to food, like there is an organism called Listeria monocytogenes. So certain foods, like baked beans and some other, kind of processed foods, if been kept for a while, can also lead, to as a source of transmission of meningitis.
So, who is at risk? Is there a particular age group that is at risk? And plus, are there some kind of situations that could expose you to getting?
Okay, yeah. So we have things that can make one to likely have meningitis, and then one of those things is age. Okay, so it's common in children and adolescents most times, and then in the elderly. Why? Because at that point in time, they've not developed enough immune response, okay, that can easily ward off this infection. So for example, in adults, where we have built some level of immunity, we can easily fight off this infection. But then a neonate that is just 0 to 28 days, or an adolescent or a child, they don't have that sufficient immune system. So in a way, they are prone to having meningitis compared to other population. And also in elderly, usually from age 65 and above, one can also have meningitis too. People that stay in overcrowded places. I said earlier that these things is transmitted through respiratory droplet. So sneezing, coughing, imagine like you have about 100 people stay in a very small dormitory, for example, and then one person has this infection. It can spread it across, and then it spreads quickly, to everybody, and then one can come down with the symptoms of meningitis. Again, if one has low immune, or the person is immunocompromised, for example, a patient that has diabetes or HIV, that's human immunodeficiency virus, these conditions, they tend to reduce the immune system. So when they reduce the immune system, it makes the person prone to having this infection. Then again, usually during the dry seasons, as mentioned earlier, usually periods between December to June. Those periods are very, very dry, and then the humidity is very low, and then it makes the virus or the infection easily transmitted. So unlike when you have wet seasons, you don't have easy transmission of this infection through respiratory droplet. But then when the humidity is low and then you're having dry seasons, usually between December to June, one can also have this infection. Then smoking, funny enough, active and passive smokers, because of relation to also the immune system, passive smoker, instead that you might not necessarily be smoking, but then imagine going out with people that smoke every time, and then indirectly you're taking this. It can also reduce your immune system and also serve as a means of transmitting this infection to the respiratory system, and then from there to the brain or the spinal cord, and thereby causing meningitis.
I'm really concerned when you mentioned you find it more amongst children.
Yes.
So I was going to ask, is there a vaccine to protect the children from this?
Okay. Well, there are a lot of preventive measures as regards meningitis. In fact, the meningitis is usually common around the sub-Saharan Africa. The outbreak of meningitis has reduced. Why? Because one, they've been provision of vaccines mentioned. Now, recall that I said most of the causes of meningitis are infectious causes. So imagine giving a vaccine to a child that can prevent the child from having this infection. To go a long way in flattening the curve of meningitis. So one of the recent one that was introduced was the meningococcal meningitis vaccine that I mentioned. It was introduced in 2010.
That's a long time.
Yeah,
That's
long time
11 years
ago.
back.
Yes, it was during 2010, and then it has been gaining a lot of acceptance.
Is it free?
Well, it's not free.
Because that's the problem we have here.
It's not free.
When you mention immunization, there's some basic immunization that you should take.
Yeah.
So nobody mentions the other ones.
Yeah.
So what happens in this case?
It's not free. The thing is, the governing body or the WHO are finding a way to reduce the cost, because the cost of production of these vaccines are quite expensive, and then giving it at no cost might not, lead to continuity of the production of this vaccine. But what they are tending to do is to see how this vaccine can be made available. I think at the moment it's about $0.6, trying to see how people can easily access this vaccine. So as I said earlier, this vaccine was introduced into our immunization schedule, and then usually at 9 months, it's expected that the child should receive the meningococcal meningitis vaccine. But then a lot of people are not aware. That's the truth. And then because of, it's not something...
That's why you're here.
It's not something that, a lot of health institutions are even making it available. And that's the first thing. Two, people are not even aware to know, okay, my child's supposed to have taken this meningococcal meningitis vaccine at 9 months. So, well, a lot has been done because the provision of the vaccine has increased. A lot of health institutions, especially the primary health centers, are now having more access and there are more availabilities to this vaccine. So at 9 months, the child is being vaccinated. But in other climes, for example, in Europe, US, because of it's not very common, so what they do is for their children, at least, they can even start as early as 2 months.
Okay.
So they give the vaccine at 2 months, 4 months, 6 months, and 12 months.
Dr. Ebuka, we'll go on a short break. When we return, you will tell us about the signs and symptoms of this infection. We'll take a short break. When we return, Health Watch continues. Stay with us. If you're just joining us, the program is still Health Watch, and our guest is still in the studio, Dr.Ebuka Anyachebelum. He is a public health physician. You've said a whole lot about the vaccine of meningitis, and the concern should be, what are the signs and symptoms? Okay. I said earlier, like, first time I heard about meningitis, what comes to my mind is your neck will bend and all of that. Okay. So I'm like, I'm not seeing all this neck bending, what's going on? Okay. So what are the signs and symptoms to look out for?
Well, one thing we should notice is that meningitis is actually deadly, especially if the individual does not present immediately to the hospital. Even if you present immediately to the hospital, there's still a chance, okay, about a 10% chance that one might still die despite early presentation to the hospital. So early presentation is key to increase your chances of survival. And then one of the common symptoms of meningitis, because it's an infectious process, one thing you will note for an infectious process is fever. Okay, so the body temperature goes up. Okay, it's just a response to infection. And then apart from that, you have what you call headache. I said that these meninges, which are the covering of the brain and the spinal cord. So imagine that it's been inflamed or there's an infection. There will be increased pressure in the brain. And when there's increased pressure in the brain, one can present with headache. So headache, fever are one of the most common symptoms. 3, neck stiffness. Remember the way the covering of the brain is and the spinal cord, it runs through down, from the head down to the spinal cord. So if there is an infection, an inflammation, or a swelling of this meningitis, which you call meningitis, one can present with neck stiffness. So the neck becomes stiff, because normally you can see I'm moving my own easily. Someone that has it to just, find it quite tough, and then you are trying to, elicit it, and then it's finding this chin to even get, to the chest, and then it's very difficult because of that. And then other things, one can have nausea, that's feeling of vomiting, one can vomit, one can have, increased sensitivity to light. So normally I'm looking at light around me, and then it's not supposed to have that increased sensitivity, but the sensitivity can be high, in a patient that has meningitis. So they just have increased sensitivity to light. So those are the most common symptoms: fever, headache, nausea, vomiting, neck stiffness. And then there's some other signs we elicit, but then I don't want to start mentioning them. It's quite, a medical term, but then you just elicit that this patient has a meningitis. Then for children, children or neonates or infants are actually quite different, because then how do you want to elicit a lot of things? You have to be have a high index of suspicion for you to know that a child actually has it. And now if a child is in the neonatal period or infancy period, which is usually period less than 12 months. Now, for that kind of child, you have to be very observant. 1, if the child becomes irritable, as in easily just cries. I mean, unlike before, the child is always playful, and then any little thing, the child just starts crying. You have to watch it. It could be, an early telltale sign of meningitis. Poor feeding. You're giving the child breast, the child is not taking. And you're wondering what's happening. I'll take now. You think that the child does not want to eat. No, it's because there's an infectious process going on, and one has to check. And then for children, there's what we call on top of the head, we call it a frontal, and it's a hole that's usually around the side. Everybody has it, exactly, everybody has it. So for a child, usually, because of that place has a connection to the brain, when there is a meningitis, that place becomes tensed and hard, and then it bulges.
Okay, bulges. It
Yeah,
goes
it can
up.
bulge. Yeah, it can bulge, and then it can become tense. You know that, oh, there's a pressure effect going on in this brain, likely from an infectious cause, and likely, a meningitis. Then aside from that, you can have fever, as mentioned earlier. So fever is yet another sign and symptom you can pick, in a child that has meningitis. Then vomiting. Yes, you feel the child is always vomiting. Feed, the child is always vomiting. You feed, the child is always vomiting. You should suspect that, well, this could be, meningitis. So those are the most common symptoms of meningitis. Other things, are just the normal ancillary or normal things that we see.
So what's the first aid you give to a child? If, for instance, we're all here and our kids are in school and the teacher just discovers that this child is having body temperature, is being consistent.
Okay, so in treatment, you have to look at two things. First of all, treatment of the patient that has meningitis, and to treatment of the contact.
Okay.
So you have to treat the contact of person that had contact with the patient. So now let me explain.
How do you identify the contact in the school?
Okay, let me explain now. So for example, let's say for treatment now, first of all, the child has to do a test.
Okay.
Or the patient has to do a test that has meningitis. So that test is called a lumbar puncture. I will explain. So lumbar puncture means they go down to the back, okay, and they do a procedure, a very sterile procedure, a procedure that must be free of germs and and done in a theater, as it were. Now the idea is this: we want to get something from the back, and that is a fluid. That fluid is called cerebrospinal fluid. And now that fluid is in between the covering of the brain, which are called the meninges. So it's expected that if there is an infection of those meninges, there will be some features that we have to look out for when doing a lumbar puncture. So the lumbar puncture is just a procedure which we use to collect a fluid, which is the cerebrospinal fluid from the back. Now, once the fluid is being collected, you look at the appearance. Is it looking turbid? Is it looking not clear? You know that, if it's not very clear, okay, there's a sign of infection here. And then you take it, you do some microscopical findings, and then you're looking for so many things, especially looking for the organism, that is isolating the organism that caused the infection, and then looking for other features. So you're looking for other parameters like, is there small protein, is there high glucose, all those things style to make our diagnosis that this patient likely has. There are some cases that you might not even culture anything, and that is common in viral causes of meningitis, because you might not culture a viral organism. So it doesn't mean that the patient does not also have meningitis. So when it's actually being isolated, and then you discover that, okay, yes, this is meningitis, treatment is commenced immediately. So for the child or for the adult or for the adolescent, immediately, because I said the most common is bacterial causes. There are other causes depending on what you find, but the most common is the bacterial cause. And then because it's the bacterial cause that's the most common, you place the child or the adult or the adolescent or the patient, as it were, on antibiotics. Okay. So antibiotics remains the mainstay of treatment. And then early diagnosis is the first. 2, early treatment. So placing the child or the patient on antibiotic is very key in increasing the chances of survival of that very particular patient. But remember, I said aside from that, the contact. So for example, let's say the child is in a school, and then let's say the child is in primary 2. I mean, it's likely that almost everybody in the primary 2 would have had contact with the child, and maybe the teacher and stuff. So you go as far, because then it might not be showing in that, because one can have the infection now. For example, the meningococcal meningitis that I mentioned that causes the epidemic or the outbreaks that we always see, it takes about 10 days before the symptoms start showing. So it's possible that I can have it now, and then next day I'm not still showing any sign and symptom. Next 3 days I'm not showing any sign and symptom. 5 days I'm not showing anything. 8 days, 9 days, and probably within that 8 to 9 or 10 days I start showing symptoms. So what about those people that have had contact with that child in class? You want to prevent an outbreak. So what you do is that you take those children, isolate them, and then place them on drugs. Now, there are certain drugs which we call chemoprophylaxis, or drugs that prevent. So we place them on drugs that can prevent, them from having, meningitis. So it's treatment of contact and also treatment of the patient.
Wow, thank you so much. Before you leave, in just 1 minute, what should be the preventive measures? What should we be doing at this time, knowing that we're in Lagos? The crowd is crazy. If you go to the island, everybody's busy buying things for the festive period. So how do you manage yourself? Okay,
well, you have to be very, very careful, as I said, during this period. The idea is that WHO is looking for how meningitis can end in 2030. And then one of the things I will encourage people, if you've not gotten the vaccine and then you're due for the vaccine, try and get the vaccine for meningitis, especially if you're an adolescent. 1. 2, avoid overcrowded places. These are the risk factors for having meningitis. So if you see a place that is very overcrowded, the best thing you can do is at least wear your face mask and then try and give some level of social distancing, so that in case they cough or sneeze or they have any body contact or body fluid contact to you, you will not have, you may not likely, let me put it that way, have, meningitis. So those two are very important: overcrowding and also looking at the preventive measures, and then having a high index of suspicion whenever you see a patient that is looking sick. So as I said, if you see a patient looking sick, coughing, sneezing, anything, just give that patient or that person a gap. Honestly, that's what I do most time, because then you never can tell. What if he's carrying the infection and then you don't know about it? So social distancing, avoid overcrowded places, try and encourage vaccination, usually for adolescents and children.
Wow, thank you so much, Dr. Ebuka. We've been speaking with Dr. Ebuka Anyachebelum. He is a public health physician. Thank you so much for coming on Health Watch.
You're welcome.
Moving on, we have a feature on World AIDS Day. World AIDS Day was celebrated on the 1st of December. This feature is highlighting the modes of transmission and the preventive measures of HIV. World AIDS Day is an international day designated on the 1st of December every year since 1988. It is dedicated to raising awareness of the AIDS pandemic caused by the spread of HIV infection, showing love and care to those who are living with the virus, and mourning those who have died of the disease. This year, the theme is End Inequalities, End AIDS.
By ending inequality, we mean ending inequality on those that are disproportionately affected by HIV and AIDS. They include the women, the young girls, the female sex workers, the female that inject drugs, the trans women, and the entire key population. These people are discriminated and stigmatized, and thus reduce their access to HIV prevention and treatment services.
The human immunodeficiency syndrome can be transmitted through different modes, such as the exchange of a variety of body fluids, mother-to-child transmission during pregnancy, use of unsterilized swabs, and through blood transfusion. According to UNAIDS, it's been 40 years since the first AIDS cases were reported. HIV still threatens the world. However, it can be prevented.
What are the ways by which you can prevent HIV and AIDS? 1 is consistent use of male and female condom. 2 is the use of ARTs. By ART, we mean pre-exposure prophylaxis. These are drugs that are given to a negative person to reduce the chance of contacting HIV and AIDS. We also talk about voluntary male circumcision. We talk about harm reduction for people that inject drugs, and we talk about prevention of mother-to-child transmission of HIV. I enjoin us all to come together to ensure that the UNA's 95-95-95 targets is achieved. By this, what it means is that 95% of those that are positive are identified, 95% of those that are identified are placed on treatment, and 95% of those placed on treatment are virally suppressed.
Everyone is a stakeholder in ending the response to HIV and AIDS. If we all work together, a HIV-free generation is possible. And that's much we can take on this week's edition of Health Watch. Remember, we will preach on this program, health conscious people live longer. That feature you just saw on HIV. There are 3 rules to preventing HIV. The ABC rule: A for abstinence, B for being mutually faithful to one faithful partner, and of course C to correct consistent use of condom. Send us questions, your inquiries to okibeinkem@gmail.com or NTA Lagos Channel 10@gmail.com, or send a text only to 0706086547. My name is Nkem Okibe. Join us same station, same time next week. See you then.